Hello. Can you all hear me? Good evening to everybody. Can you hear me? If you can hear me, can I have one? Okay. Thank you. Shakely brothers and sisters. So tonight our topic is asthma, and this what we are going to show you. Asthma is a disease that affects your lungs. It is one of the most common disease that in children, but adults can have it too. Okay. Asthma causes wheezing, breathlessness, chest tightness, and coughing at night and or early in the morning. Now, let's see how the occurrence worldwide. Okay, actually, asthma can occur at any age in children, adolescents, adult, and elderly. Yeah, asthma is not infectious. However, viral respiratory infection, such as common cold and the flu, can cause asthma attack. Now, estimated is about 300 over million people are affected by asthma worldwide. And and in Malaysia, worldwide is a serious disease. Estimated death or around 300 over 1,000 deaths each year globally. And more than 13.8 million people do not achieve good control. Greatly impacts daily activity. And also in children, asthma is frequently associated with allergy. But asthma with adulthood is often less often allergic. When asthma is well controlled, asthma subjects are able to exercise and perform a top sport. Asthma is most controllable with dose of steroid. Now let's see some statistic in Malaysia. In Malaysia, as you can see, there are about 2 million sufferers. 2 million, quite a number. 90% are uncontrolled cases. And in most of the time, the children are 50% affected by the wheezing at the age of 6. So that's quite an alarming figure. Yeah. Now, let's see actually how asthma attack when they attack you. Yeah. How does the whole thing work? Okay. We have two lungs, as you all know, left and right lung, and they are the one that is very important to for the oxygen exchange. When we breathe in air, the lung will take out the oxygen. Let's see how it works for our breathing, for our usage by the tissue in our body. Yeah, this is how the whole lung look like, the anatomy of the lung. Yeah, kalau you boleh remember when you are in school, you learn all this. Kalau you are science student, you should learn all this lah. These are all the trachea, the bronchioles, and the alveoli. Yeah, these are the things that the lung need to have that gas exchange, oxygen against the other gases that we don't use, like the carbon dioxide that we exhale out. And how does it work when asthma attack? Yeah, asthma is a chronic lung disease that inflame and narrows the airways, leading to difficulty in breathing. Yeah, and it affects almost 300 million people globally, and about 250,000 people will die prematurely all over the world. Yeah, that's a big figure to talk about. And almost 80% of the adult almost 80% of the adult asthma attack occur in low-income countries where hygiene is on the low side. Yeah. And how does it attack? Estimated that attack will grow to about 100 million asthma attack by 2050. So that's a very 2025. Sorry, that's a very big figure to talk about. Yeah. And all asthma deaths are preventable. It's very much controllable with the right management. So actually, when you control it properly, you have proper medication, proper conditions to control it, you should be on the right side. Yeah. When there's asthma attack, what actually happens is the disease causes inflammation and narrowing inside the lung, especially the air, bronchus, restricting air supply. During the development of asthma, the airway swell and become extremely sensitive to some of the substance a person might inhale. So environment plays a very important role in asthma attack. When this increase sensitivity causes a reaction, the muscle that controls the airways tighten. Yeah, eventually this will restrict the airflow or airway even further and trigger an overproduction of mucus. As you know, mucus is uh, an, something that is important also to filter the air that is coming into our lung. So when we have an overproduction of mucus, that's where the danger comes in. Okay, what happens when asthma attack you? Okay, this is how your whole body look like. When you are normal, you have a very relaxed, smooth muscle that leads to your lungs. And when it's when for an asthma patient, it's a bit inflamed and thickened. Let's see how it attack. Okay. Okay. Smooth muscle in the lung help the airways to expand and contract as necessary. Like when we breathe, it will expand and contract as the demand asks for the person asks for air. Yeah, the lung will respond systematically. Yeah. Then what happens when inflammation? The airway wall become red and swollen, and the airway narrowing. Small muscle around the airway tighten more easily. So this is what happens actually. The muscle tighten around the airway. Yeah. And what actually happened? The air trap in the alveoli, where the oxygen intake and carbon dioxide is being done, become more difficult. And tighten muscle, smooth muscle around airways, all tighten. The mucus of phlegm, excessive and sticky secretion can block the airway. So this is what actually happens when the attack comes in. The mucus, which actually is important for the filtration of air, will also become a danger to the individual. Yeah. What happens when asthma attack? This how they describe it. Example expression experience when an asthma attack occurs. A terrifying experience. They will tell you, I struggle to draw in full breath. So it feels like I am drowning. It feels like there is something heavy on my chest. The next one is it feels like there is a cloud in my lung. Okay. Now, if you understand how COVID-19 attack is almost the same, but slightly different. The only thing that is the same is attacking the lung. Yeah. So, but asthma is not like COVID. COVID is different, very much different actually. Okay. Asthma is asthma. Okay. How the symptoms, as you can see, when a person gets an asthma attack, first they have difficulty in breathing, and when they cough, they will have a dry cough. Okay, cough without phlegm, and then chest pain or tightness will occur in their body, and then at night they will cough frequently, and also they have shortness of breath. And the most common thing that we notice is the wheezing. Wheezing is the sound when you breathe, like a siren sound. Ooh, yeah, that's wheezing. Okay, that's very common one when a person is said to be an asthmatic patient. Yeah, and what will happen? Essentially, they will have pale and sweaty face, blue lips, or fingernail that is blue, which shows that they are lacking oxygen. And then a choking sensation, difficulty in talking, and also very anxious because when you are short of breath, you tend to be very anxious because you are more inclined to look for to have a full breath in your lungs. So that's why they become very anxious. Okay, what are the key triggers to all this attack? One of the first one is actually moles. Moles are actually a common part of the environment and can be found almost anywhere. Yeah, mole. Anywhere that moisture and oxygen are present. So actually everywhere. They belong to the kingdom of fungi and live in moist places such as soil, plant, or in dead or decaying matter. So when you eat your bread, after the expiry date, you will notice if you let it be on the table, you will see a lot of mold growth. So that's what mold is all about. Yeah, dust mites are actually everywhere also. They are microscopic insect-like pests that generate some of the common indoor substances or allergen that can trigger allergic reaction and asthma in many people. So dust mite also another important factor to this attack. Okay, hundreds and thousands of mites are living in your bedding, mattresses, upholstered furniture, carpet, a curtain in your home. So they are everywhere. So you got to be careful. And they feed on dead human skin found in dust. Okay, the next one is fragrance. Okay, fragrance is, as we know, very pleasant smell, scent, especially a somewhat strong one that you call it, notice a very strong fragrance. Okay, there are also all your perfume that you use every day. And also some of you may be using those fragrance spray in your house. So those are called fragrance. Yeah. The next one is cigarette smoke. Cigarette smoke, when a smoker lights up his cigarette, or the trend now is they inhale the vape, isn't it? Vaping, they call it. So they inhale vape and exhale the vape fumes. So the exhaling of the fume and also the sensation, the burning sensation of the cigarette are actually the smoke. They have category of the smoke, secondary and primary smoke, whatever. But those are all the smoke that also can trigger asthma attack. Yeah. And the other one that is also very important is cleaning chemicals used for cleaning and in cleaning products, such as laundry detergent, bleachers, dishwashing product, and other household cleaners, which help to improve your house to make it more clean and hygienic, but also to a certain point of time, it will attack the asthma patient. Okay. The last one are pets. I'm sure a lot of you also have pets, but pets are, as we know, are domesticated or tame animal. We keep as companion, we care them, but some of the pets also will affect asthma patients. Okay. Now let's see how the asthma complication can come in. As mentioned earlier, asthma is not infectious. However, viral respiratory infections such as cold and common flu can cause asthma attack. Now, a person who is an asthma patient can have a normal life. Okay, when you have a controlled environment, yeah, they can also perform even top sport or for an asthma patient, but in a controlled environment, yeah. And although incurable, it is much controlled with the right management. So the main factor here is the right management. It's not curable, but you can manage it well. Now let's look at some of the things that one of the factor that really attack asthma patient. Okay, let's look at our household cleaning product, which we are very proud to say that is non-chemical and biodegradable. So this is a common contributor of asthma occurrence in a household. Yeah. Okay. One of our product, the Get Clean product. Let's see what we have in the Get Clean product. First of all, it's not causing allergic. It doesn't cause allergic. Hypoallergenic, we call it. Yeah. Non-toxic, no chemicals, no chlorine or fragrance, natural and organic, and biodegradable. That is very important, biodegradable, because we don't want things that is polluting the planet, and no phosphate, which also cause imbalance to our ecosystem. Yeah. Now, I would like to share a very strong testimonial, okay, from our, you know this person, right? Our chairman and CEO of Shell Corporation, Roger Barnett, and it occurred to him that in 2003, way before he took, or rather he took over Shackley's management, Sloan Barnett talked to a writer from a magazine, and she explained what actually made them think twice about the environment, because in 2003, her son Spencer, the one at the back there, at that time was only 3 years old, began coughing. So she thought little of it until his heart began pounding as if he were trying to beat out of his chest. That's what she wrote in the magazine. Okay, they went to the hospital and took Spencer to the hospital. And at the hospital, after 2 days of intensive care, the doctors determined that he have reactive airways dysfunction syndrome. Okay, that's another form of asthma. Okay, that's how the whole thing started. Okay, and then when she start to dig back at the past history, they have no family record of asthma going back generations. So they decided, and they think is very, very strong that the cause was environmental. And what she did a lot of research. She did a lot of research. She did a lot of study, and she compared a lot of occurrence on how this environment can affect the population, especially small children. And in 2004, an International Journal of Respiratory Medicine was noted that at least 6 epidemiological studies have found a strong link between the use of certain cleaning products and asthma. So that's how the whole thing started to the family that now is heading Shakli, Roger Barnett and the family. Yeah. So let's have a look at our whole range of products that we can help in our Shakli, our asthma friends. Yeah. From the nutrition point of view, let's look at the range of effective products for our health. Yeah. These are the range of products that we would strongly recommend to those suffering from asthma and for those wanting to have a better health and healthy lifestyle. Yeah. As you can see, the range here is complete. It's almost, in fact, it's complete. Okay. Now let's look at it one by one. Okay. Number one is Vivix. Vivix is our main contributor and our star product. As you can see, it decreases airway hyperresponsiveness. Yeah. So your airway will be very clear for your breathing for this asthma patient. Anti-inflammatory and reduces inflammation. So every time there's an attack, it will help to reduce that anti-inflammatory attack. Yeah. And also it's a genetic regulator. Genetic regulator just simply means regulate the genetic function of your cells, protect and repair cellular DNA. So this is much important. Okay, it protect and repair the cellular DNA so that it will produce a much healthier cell all the time. And then Nutriferon. Okay, it helps to treat upper respiratory tract infection. Yeah, respiratory infection because Nutriferon was designed for airborne attack, airborne disease. Yeah, as you can see, first it appeared in the market because of the SARS attack. Any airborne, Nutriferon is the best. Okay, designed to naturally increase levels of interferon and provide immune support at the cellular level, and it will help the patient to reduce frequency of attack. Yeah. Next, we have the omega gut. Okay, it decreases responsiveness to tighten of smooth muscle. So this will help to relax the muscle, the smooth muscle, not to be too how do I say, to response to being tightened when an attack occurs, and reduce airway inflammation. So omega gut will help this this restriction of the airway. So inflammation and restriction. So it will help the asthma patient better. Anti-stress, and then also stimulate our immune system, which means to say it will help to reduce the attack in future. Yeah, and improve blood circulation between lungs and heart, which enhances immune system and nourishes the lung. Yeah. Our next product is Keratomax. Okay, prevents and improves condition of lung respiratory disease. Yeah, increase the number of infection fighting cells. Yeah, reduce oxidative stress, which causes the imbalance, of free radical and antioxidant. So this protect body cell and tissue. So Keratomax is very good in this because anything that is infection fighting, Keratomax is also among the best. Yeah, and let's see the next. The next one is our very popular vitamin C, and it combat inhaled irritants. So when you start to inhale, or rather when the asthma patient start to inhale irritants, it will help to combat all this. Okay, and also it will stop the bacterial infection and improve nose allergy, which also actually common occurrence to asthma patient, bacterial infection. Yeah, support the cell-mediated immune response, reduce asthma symptom, and neutralizes oxidative stress. Okay, that's our vitamin C. And vitamin E, the next one. It helps prevent inflammation in airways, decrease oxidative stress, enhances the production of the immune cells that produce the antibody that destroy bacteria. So important to have that kind of cell that produce the antibody that destroy bacteria, because sometimes bacteria attacks will occur very easily to asthma patient. Okay, that's your vitamin E. But now tak ada stock lah, so hold on first lah. And the next one is osteomatrix. It is anxious and stress lah. Osteometry is good, easy, anxious and stress, because by itself, osteometric will help a lot in relaxing your muscle. Yeah, reduce airway muscle hyperresponsiveness again, maintain regular heartbeat, nerve impulse, and calms the nerve. Reduce and prevent asthma attack. Yeah, so that's where osteometric come in, because osteometric by itself is a relaxant. Kalau you baca the gist of the product, is actually help to relax your muscle. So overall, it will relax your muscle. Yeah, and next one is our B complex. B complex is very important because it convert all your food into energy lah, and it helps to reduce wheezing and other asthma symptoms. Okay, reduce frequency of attack, reduce stress, and keep nerve functions healthy, regulate immune response to allergens, and reduce allergy and asthma symptoms. So these are important because every time there's an allergy symptom, the asthma patient will suffer a lot. Yeah, so that's where B complex come in, and this one that is the most important energizing soy protein. Okay, as if you read about the history of soy protein, why is it called protein? It's called protos. Protos is actually the first thing that you must have. So anything for cell repair or for cell building, you need protein. Whether you like it or not, you need to take protein. Okay, so that is very important because ASP will help a lot in overcoming all this asthma episode, better control of asthma episode, help to maintain muscle tissue repair and proper function of enzyme and hormone. So ESP is very important for all this. Yeah, and our next product is our garlic complex. Okay, garlic complex is also very, very important because it's a natural antibiotic. What it will help is actually detoxify the body and protect against infection by enhancing our immune function. Yeah, garlic also effective against allergy and asthma symptoms caused by histamine, the compound that causes inflammation in airway. Yeah, a lot of times when you have attack like this, they usually give you an antihistamine tablet. So these are the one that is to stop this inflammation. Okay, so garlic is a natural antihistamine. How do I say? Antihistamine attack for the asthma patient. Yeah, so that's where garlic comes in. And from all this, we are very, very proud to say that we are very proud to have the Shakti difference, which is very important because we are very proud to say it's always safe and always works and always green. Okay, always safe. We know it's always safe because the company runs a lot of tests to make sure the quality of the product is according to what we need, according to what the body needs. Okay, and always works. Okay, you are very sure that the product will help you in your allergy attack or in whatever you want it for. Okay, so that's why we can always say and very proud to say that it always works and also always green. Before even the world is talking about environmental how do I say greenery and to take care of the environment, we are already talking about it long time ago. So Shakti have all the things that you need to have all the product that is always helping in your nature. Yeah, and we have a lot of data, as you can see there, 125 published journal and all the tests, and we also spend millions for our R&D. So we are very proud of our heritage. The next one is I would like also to touch is our landmark study. See, landmark study is a very important milestone for Shackley because it's an independent study done by the University of Berkeley, California, to see how over a period of 20 years, how much supplements affect or rather impact the individual who take the supplement. And we are proud to say that all those who took Shackley products over the period of years have uh, very low disease prevalence almost in all the occurrence. In fact, from the study, it shows that the people who don't take any supplement is better than taking other supplement than Shackley. So Shackley is always the best choice. As you can see here, the data shows by itself. This one, so nobody can simply claim anything because it's a public university data. Okay, and here, as you can see, the landmark study, the prominent the parameter that they test, you can see there by yourself. Take little or no medication, and then the rate they help better, lower risk of dementia, etc., etc., etc. So be very confident that you are taking the best product in the world. And here I would like to share this immunity set, which we have just spoken earlier. The UV is 332 and the PV is 1109. And the best part is everything all this is free shipping. So when you want to start, you can also start like this. You can call it the immunity set. You can present to your customer and you can always present like this. Yeah. And what also you can do, you can also duplicate. Okay. You start to have a duplication process. You take you take 3 sets and you share with 3 of your friends who themselves take 2 sets. And you can hit your first rank as supervisor. Very easy, isn't it? Very straightforward and very fast. So look for friends and who are willing to duplicate or other who are looking at the business seriously, and we can always duplicate this and they can start sharing with their friends. Yeah. And before we end, I would like to say this. Your health is an investment, not an expense. Always remember that whatever you are buying for your body, you are investing. You are investing in good health for future and also for your own well-being. This will help to have for you to have a better life in future, because whatever it is, when you're healthy, everything is much better off. Yeah. And before I end, I would like to just pass you this message. Happy sharing and happy doing Shackley, and I'll see you again next time. Good night.